Hello everyone, this is the case of 64-year-old lady with severe osteoarthritis in both her knee joints, more on the left side, with significant restriction of the range of motion due to huge osteophyte over the posterior aspect of the knee joint. This is the before and after surgery X-ray, which shows that the huge osteophyte has been removed and she has regained her complete range of motion after the surgery. This is the video of the same patient walking after 45 days from the surgery. As you can see, the gait and the walking style has improved and she is able to walk freely without any pain and discomfort. She could actively participate in a friendly cricket competition at 6 weeks from the surgery. Thank you.